Healthcare's phone lines are overwhelmed. Patients wait on hold, staff juggle impossible call volumes, and appointments just slip through the cracks. The result? Frustrated patients, burned out teams, and revenue left on the table. But what if every call could be answered instantly, every patient need resolved without overwhelming your staff? Welcome to CareTalk Executive Features, a series where we spotlight innovative companies and leaders working to advance the healthcare field. I'm David Williams, president of Health Business Group, and my guest today is Chetan Reddy. He is the CEO of Confido Health, which is using AI voice agents to transform how healthcare organizations handle patient communications. Chetan, welcome to CareTalk.
Thank you so much for having me, David, and thanks for the nice introduction.
Yeah, it's really wonderful to have you here. And I want to see if you could set the stage by letting me know, what are patients and staff experiencing on the phones these days, and why is access under strain at the moment?
Access has always been limited, but somehow most healthcare organizations felt like if we staff like our front desk with people, like that's going to be taken care of. But over a period of time, after doing that for like almost 10 years now, most of them have realized that it's just very hard to find staff who could always be available for patients, and different technologies that they have tried have not been able to solve for that. And suddenly when AI becomes like main topic of discussion across the world, healthcare organizations have realized that maybe this is the savior now. And they're just trying to go solve for it. But yeah, fundamentally what's broken is not having enough manpower to take care of different patient requests that come through every day. And that's the core issue in focus today.
Got it. So, I've always been on the one side of the counter, coming in, checking in, providing my insurance information or whatever. But what's it like on the other side of the desk? What's a typical day like? What kind of volume is someone expected to handle?
Purely in terms of like the volume, I'll give you an example of one of our customers based out of Dallas. They're a nephrology group. They're almost looking at anywhere from like 5,000 to 6,000 calls a day. And that's a lot. And this could be from anything from like scheduling to prescription refills to follow-ups to lab requests to different types. But I would say like at least 50% of them are appointment related. So you're looking at least 5,000 to 6,000 calls per day for a 30-40 location nephrology practice.
Got it. So, obviously when you have that volume of calls, or frankly, even something a lot lower, some are probably not going to get through and some are going to be unanswered. And I know I've been on the other side of that as well. Try to make a call to a physician's office, you're on hold, you get cut off, whatever. Well, what happens? I mean, what's the downstream impact on patient care? And what's the financial impact to a practice if a call doesn't get answered?
Yeah, unfortunately, that's like the status quo right now of most of the specialty care practices running sizable operations today for patient access and like any operations related to patient engagement. And the biggest, I would say, bottleneck for the patient on the other side is the fact that there's no one picking up their phone call, or they're put on hold for like more than 5 to 10 minutes in like many cases, depending on what's the bandwidth that's available on the other side. And that whole time could be really frustrating depending on why you're wanting to talk to that practice. And I'll give you an example of one of these patients that I was speaking to during the early days of building this company. Patient had like a small kid, and they were all sleeping. It's midnight, and the kid just started crying at like about 1 a.m. in the night. And the parents were like really, really like at that point, like really under stress. They just didn't know what to do. And the first thing that they would do is just call the office. They don't know if it's an emergency, and most people don't want to just like get into ER not knowing the emergency because it's just like really expensive. But they still want to talk to a provider, and it took them 6 to 7 minutes before they got like a person to pick up that phone call. And it's so sad that even the staff who picked up would just say that, hey, I've gotten your request, we'll arrange a call back. And they waited for like other 30 minutes just waiting for someone to call back. And by then it's like 35 minutes of your child crying at like 1 a.m. in the night. Imagine the amount of uh, like stress that the parents would have been on during that time. Uh, and I feel that's the qualitative, I would say, description of like how does it really affect patients. And financial numbers and all of that, they're great. It's important for practice operations, but fundamentally what bothers us is the fact that like why do patients have to go through something like that if there's a better way to handle it. But yeah, hope that makes sense.
No, it sure does, and I could see that. It's like a literal nightmare up in the middle of the night and trying to be in touch with a healthcare provider. Now, one of the things that we hear a lot about is workforce shortages throughout healthcare. We hear about doctor shortages, patient shortages, not patient shortages, but nurse shortages. All sorts of issues that are out there. Where does a workforce issue manifest itself when we're talking about patient access and phone operations? Do we just lack the people to be answering the phone? Do they burn out? What's the issue there?
I think the issues are threefold here. Uh, while there are different statistics of the workforce shortage right now on the internet, uh, but the bottom line is that no practices have enough staff to handle different operations related to patients. Uh, but I think the reason why I call it threefold is that maybe it starts there. It starts from the fact that you do not have enough workforce for especially like running your call center operations. And you may find people, but I think in many geographies in the US, uh, person working at Starbucks like makes slightly more money than a lot of people working in healthcare. And a lot of young generation, I think, they just don't want to be doing work that obviously pays less, and it's such a thankless job, like taking care of patients all the day. It just takes so much to be doing that. And like huge respect to like people who are doing that today. So I think that workforce shortage and the like competitive like wages versus like the other options that they have, I think that's where it starts. And the second issue is that I mean, it's not like a bias that I have, but I genuinely feel like the technology stack that exists today to support them is not up to the mark. All they have is a bunch of phone systems where there are different call logics set up to queue people, but not actually solve for the core issue of like helping them answer what they're looking for. I think that's pretty suboptimal at most of these practices. And that was the best option. So I'm not blaming them, but that's the best option. So they just went ahead with it. Uh, and the third problem, having worked with like thousands of sites right now, I can tell you that most practices do not have the right SOP or like guiding sort of materials in order to like scale that operations really well without that breaking. So people try different sorts of things, from onshore call centers to hiring people at the site to offshore call centers. They experiment more all the time. They just, none of them have like really good processes and SOPs, at least in specialty care, in a lot of group practices, to like absorb any sort of technology or process intervention to make that better. So I think these three are reasons I would point out as like core issues right now.
So, Chetan, you have characterized the problems quite well, and of course, you built up a company that's going to address those. So, maybe you can talk a little bit about what Confido Health does, and in particular, in the introduction, I talked about handling every call. What does that mean, handling every call, presumably from beginning to end?
When we say like we handle every call, what we mean by that is we are building a technology that can truly become the first point of contact for all the specialty care practices across the US. And when I say the first point of contact, I'm referring to a lot of inbound calls that every practice gets from all the patient panel that they have. It could be for like n number of reasons or use cases for which patients end up calling a practice. Uh, and it could also be for any sort of outbound calls for specific campaigns or specific workflows for which they want to like reach out to patients. So we are building the technology and we're building a lot of processes around it to ensure every practice now has like an extended agent network that can handle both outgoing and incoming calls for them. Uh, However, a caveat to that, the stage at which we are right now, the technology cannot handle all 100% of calls, particularly a lot of clinical questions is something that we triage or forward to one of the staff members. So we still are dependent on some of the staff members to be handling complex queries where there's a lot more human intervention. But the starting point for us has been maybe start with a lot of routine phone calls with the help of agent network. And as we get more and more data, we build towards handling a lot more complex calls and eventually a lot of clinical calls as well, so that by then, if you're the first point of contact, patients get used to this experience. And then now we have like all 100% calls going through our agents. So that's the eventual vision. Right now, we do have ability to handle 60 to 70% of calls of different use cases, from appointment management to refills to payments to follow-ups to certain care gaps and other use cases depending upon the specialty.
As you mentioned, this problem isn't a new one. The phones have been overwhelmed in physician specialty offices for a while. And there's other approaches that have been tried, including technology approaches like interactive voice response, IVR, or these offshore call centers. How different is what you do?
The way that we look at and the way that a lot of our customers look at this technology right now is just like another onshore sort of team, but fully autonomous, does not need to go through a lot of HR policies, hiring, firing, constant micromanagement, and all of that. Just like an independent, autonomous set of agents who are onshore, who are available 24 hours, 7 days a week, uh, and who can speak like different languages depending on what kind of patient panel that you have. Uh, so I think our positioning in their head is that it's cheaper than onshore contact center team and less stressful to manage because obviously it's technology and it's much harder to ramp up people in such sort of a setting. And also maybe almost equally capable of like handle calls in a similar way, like just like an onshore contact center team. We don't get compared to an offshore contact center team as much because an offshore contact center team typically is most like working on a lot of overflows that onshore teams are not able to. Hence, onshore always becomes like a core integral part of your contact center operations. And that's what we are compared to because we are high value, a lot more scalable and very efficient like onshore teams. But over a period of time, we feel like all the phone systems, offshore teams would get eliminated if for the wrong lack of like good word to explain that. But uh, if there's one vendor who could handle all the operations onshore a lot more scalably, I don't see the need, and customers are not seeing the need to work with phone systems and also offshore teams anymore.
I'm wondering why you're focusing specifically on voice AI rather than the approaches some others are taking, like chatbots or some sort of other digital channels. Why the voice?
That's a good question. That reminds me of the early discovery phase of how we ended up deciding to start this company. Like we met almost like 1,000+ providers across the US, like travel to different parts of the country, just trying to uncover the mystery behind this sort of a problem that I saw as a personal experience. And after speaking to so many providers, I think it was kind of obvious that most of them obviously had staffing issues. And in that, when we tried to map what are different pain points for which they're spending a lot of time, like executing on, almost 4 to 4.5 hours of an administrative worker typically just goes towards like phone calls. And we just want to solve for something that takes almost 50% of the day-to-day time at the office, so that we could show enough impact for these practices, which could help them in many ways. Hence, we decided to start with like phone calls as a use case to show that impact. And once we become a trusted vendor, obviously expand that into a bunch of other workflows that could also be like meaningful enough for them to continue working with us.
Great. What do you find in terms of the most common use cases? I know back in the day, a lot of it had to do with refilling prescriptions or really renewing prescriptions after the refills had run out, someone trying to get their test results, billing questions, scheduling. What are the big use cases these days why people are picking up the phone and trying to reach a human?
Yeah, I think at least with like many customers that we have, uh, 50% of them, I would still put them into the front office bucket. That's largely about appointment management. And that's mostly true for all the specialty care practices that we work with. Uh, and the second largest use case uh, would be, again, in many cases, about prescription refills. They also slightly longer calls. There's a lot of information gathering that happens, which is kind of very routine in nature because end of the day, a provider has to sign off and provider is not on the call. So it's mostly like the staff collecting that information and then sending the request to the provider. So it's still like longer calls, but routine calls and mostly like information gathering. So we have seen like a lot of calls are for refills. And the third most would be around like referral management, because all of them are specialty practices. They get a lot of referrals from like other providers. So there's a lot of coordination that's going on about that. And there are a bunch of other workflows also contribute, but I would say like these are like top three use cases for which like patients end up calling.
Well, you've done a great job of describing the problem and the solution. Let's go ahead and play a sample patient call so that listeners can hear Confido Health in action.
Sarah calling from Coastal Wellness. We're reaching out to schedule your annual wellness visit. It's a really good way to stay on top of things, and we have a few openings next week. Does that sound like something you'd be interested in chatting about?
I'm sorry. I don't think I've ever gotten this done. Like, what is this for? Really sorry.
No worries at all. That's a comprehensive checkup. Things like blood pressure, cholesterol, and a general health assessment. Basically, it's a way to proactively identify any potential issues before they become bigger problems. And a lot of people find it gives them peace of mind.
Oh, okay. Is this important for me? I'm like 30-year-old. Like, does it help me in any way?
Definitely. Even in your 30s, preventative care is huge. It's a good time to establish a baseline for your health, and honestly, things change. We can check for things like early signs of heart disease or even just vitamin deficiencies that could be impacting your energy levels. It's about being proactive, not reactive.
Okay, so does my insurance cover for this, or am I expected to pay for this myself?
Good question. Most insurance plans cover annual wellness visits fully, especially when they're preventative. We can quickly verify your coverage with your provider beforehand, so you won't have any surprise bills. Would you
Sure.
like me to do that for you?
We can do that later, but do you have like a morning slot available next week for this? We can figure out the time later, but just let me know if the morning slots are available for this.
Yep, we do. We have a couple of openings Tuesday and Wednesday mornings. Would either of those days work for you? We're pretty flexible, so if neither of those fit, we can explore other options.
No, I
too.
think we can make that work. Thank you so much for calling. I'll reach out to you again.
So, Chetan, what did we just hear? And in particular, I'm curious, how was the agent able to reach resolution without having to send that caller to voicemail or to a human?
I was just waiting for you to ask this question since the beginning, but I think one of the core technology piece that we're building for is uh, in typical software language, it's called plumbing. In healthcare, uh, I think it's a much bigger problem trying to sort of set up connections between AI and the core system of records, which could be anything from your EHR to practice management to your phone systems to any other third party applications that power the operations today at these practices. I think if you ask us like where have we spent most amount of our time, is it on the voice or is it on this plumbing piece? I would say like the latter. And the main reason for that is if you think of like a new staff member who is joining like a practice, uh, staff member could only be efficient if they know how to use EHR and if they can make sense of the information that's already in the EHR. If you can't make sense of the information that you see on the EHR or any other system of record, when a patient calls, you just don't know what to say. You're just going to be like, hey, just send me the question. I'll get back to it. I'll give you a call back, which is, again, not truly solving the problem. So we've spent a lot of time investing, building into a lot of like unique technology that helps us make those connections, get like from millions of data points, extract useful information during a call between an AI agent and a patient, almost with like real time latency. That's what helps us run a lot of successful resolutions. And we've taken a lot of time to get that technology to that stage, and we're really proud of the team that has uh, built. But yeah, I think the example clearly talks about how AI was able to know that this patient is due for a visit, made sense of the information during the call, and then was able to successfully close the loop without any human intervention. And there you go, you already saved like minutes worth conversation time for a particular staff member on that patient. And in this case, AI can also do that for almost 10,000 patients at once, which would have taken many hours of staff time, which they don't have to spend anymore and spend more time with patients.
So I'm wondering how the system knows when it needs to escalate to a human compared to just handling it autonomously. Obviously, we heard it handle it well there, but I imagine sometimes it's going to be an issue. And let me draw that out a little bit further, because one of the things that's notable when you use a generative AI LLM model, um, it never says, I don't really know, I'll have to ask a person or look that up. It's just sort of like a general disclaimer at the bottom. But here it would seem to be quite important to know, yep, I'm confident of that and it's going to be correct, or I really need to escalate it. How does the system deal with that?
Yeah, I mean, if I were to explain this to like a layman, I would just simply say that we're able to do a lot of quality check while the call is happening with a lot of guardrails in place. That is like almost like hundreds of rule sets and use cases that we have trained AI on so that it's guardrailed enough to only answer questions that it's confident about and then forward the calls to the relevant staff member if it doesn't know the answer. If I were to explain this a little more technically, so we also built, uh, we've invested a lot into observability and evaluations, which is basically like a way to sort of understand pre-calls, during calls, and post-calls, uh, different different sort of scenarios as to how AI should be handling some use cases and how AI ends up handling those use cases, and constantly retrain the models with that kind of information so that it gets better and better over a period of time, which is where we are right now. So hence we have like one of the best successful call ratio in the space right now. And that helps us like really take care of sort of like focus on the question and only give the information that patient is asking for, and like simply admit that you don't know and then just forward the call to one of the staff members. And the process of like transfer is also called like a warm handoff. So we just simply connect the patient to the staff, we give staff the context, and the AI just drops off from that call, from that conference call. But yeah, to answer your question, a lot of like like our technology on observability and evals, which is almost like a real-time QC that models are running on top of models that helps us do this successfully across different call types.
Now, when the patients are calling in, I asked you a question before about, what are they calling for? A prescription, renewal, appointment, and so on and so forth. But there's also some characteristics of the patients that the system has to handle. And I'm thinking about, a practice like you're describing with getting thousands of calls. Not everyone's going to speak English. Not everyone's going to have the same accent. How does the system handle that, or does it?
Yeah, I think credit to, I would say, a lot of foundational models uh, to solve for this aspect of a conversation. If you'd ask me this question maybe in 2023, I would have given you a lot more complex answer as to how this is done. But thanks to generative AI and great foundational models that are out there, on top of which even we are powering a lot of our conversations on by building proprietary technology on top of it. So I think it's almost solved at some of this model levels, could be the speech to text and text to speech models, and also the inference on the inferencing side, the core LLMs. This is something that gets solved at that level itself, trying to like make sense of the language, the accent during a call, and then sending the information back to the model, and then trying to determine and then accordingly give a response. So we've created some pipelines that enable us for the models to be behaving in that way, and then trying to have higher success ratio during those situations or circumstances. But yeah, I think it's pretty well handled, and I would think so for most companies building in this space. It's almost like hygiene at this point. It's not like a unique feature anymore.
When you're installing a system like this and getting it up to speed, how do you measure success? Are we talking about like how many calls it could handle, how much staff time it reduces, call length and abandonment? What are the metrics that you measure, and what are really the key performance indicators?
Yeah, thanks for asking that. It's, as you know, it's very important, and probably more important in healthcare when it comes to like truly understanding how some of this works in production and what it means in real life for both patients and providers. It's important that we have some of this quantitative methodologies also to track the success of any new technology in such sort of sensitive environments. So the way that we do that is we have like an internal facing metrics, which is mostly for our engineering and delivery teams to look at, to understand some of the value that technology is building based on what they're expecting. And we have some external facing sort of metrics that are between the agent and the customer, which is in this case a practice, so that they're also able to track the impact that the system is able to create for them. On the internal side, we mostly track, we take a lot of like patient first approach. So we're trying to constantly track how happy or satisfied were patients at the end of each and every call. We collect a lot of feedback and survey from them, because if the patient is happy, mostly the practice is happy. But if you try to build for the practice, there's very high chance patient is not happy, because most practices do not have right SOPs. So we truly build for patient, almost like a consumer company versus like a B2B company. So I think call satisfaction score at the end of every call is like one internal metric that we obsessively track. And the second would be the call forwards, which is for the workflows that AI is supposed to handle, what percentage of them AI is able to close the loop on, and for what percentage of calls like it's sending back to the staff to handle. The objective is to just take more of that work over a period of time. So we constantly track that internally. And also externally, I think staff time saved is absolutely important, so that practices can feel that impact when they know that they're like bunch of staff members and suddenly they have more time. They could utilize their time for like other workflows. So I think that's something that they deeply care about. And the second important external metric is that most practices have significant attrition. So I think they're constantly trying to figure out, should we hire more people? Should we fill for this? Because There are not enough people in the pipeline. So they're just trying to figure out, uh, am I, as a practice, still able to handle same amount of phone calls or more with the existing volume augmented with AI? So that's an external qualitative way for them to figure out the impact of the solution. And lastly, for some of the practices, obviously, uh, we all in healthcare, we all care about impact, but practices who are really struggling with the financial performance, which constrains them from like providing better service, they end up focusing a lot on the financial impact as well, which is trying to understand so what sort of how many more encounters were they able to sort of get in post AI implementation, and how much costs were they able to save, both direct and indirect, which is related to staffing costs. I think is also an important metric that they constantly look for, especially when assessing the financial impact of the solution.
So you're not operating in a vacuum here. When you come into an office, or especially a practice that may have multiple offices, they're going to have some systems. They're going to have phone systems in place. They're going to have electronic medical record in place. Where does Confido sit in that stack, or how do you play in that ecosystem?
Yeah, that's a good question too. I mean, the way that we think about us is like just some invisible uh, employees at the office. So we ask our practices also to like look at us as partners, employees who are trying to help them finish up a bunch of work that they need to be doing on a day-to-day basis. And hence we look at most softwares like EHRs or phone systems and all of that uh, purely as like a way for us to sort of access information and then act upon that information, just like how any new employee or old employee would do. So use the information, act on it, just make sure your operations are running seamlessly. That's a similar approach that we have. Our agents get deployed. We teach them how to understand this information, how to make sense out of the information. We work with the staff on some change management so that as AI is starting to work on its own, what sort of other roles and responsibilities that they can collectively brainstorm upon and then trying to take charge of. So we do some of the change management and understanding the existing data stack for technology. And once we are good with all of that, once we go live, it's mostly about just executing that job on a day-to-day basis, just like how any employee would do. So that's how we look at it.
Chetan, the last question I'm going to ask you has to do with privacy and quality. I imagine if I'm a practice manager or provider deciding whether to bring you in or not, I might have some concerns about, what's the AI doing? It's obviously got to listen in order to process the question and to respond. And then the kind of quality, it's a different sort of expertise or quality than you're going to have from an individual. How do you give your prospective customers confidence on those topics?
Yeah, I think that's absolutely important, especially when you're building something for healthcare. Uh, I know I said that I talked about observability and evaluations last time. I think that's like a very important piece of technology uh, that we have uniquely to Confido Health, wherein we are able to give more transparency towards the agent actions when agent is performing different tasks, not just for our engineers to like monitor and take actions on depending on how the agent is performing, but also external facing for practices to constantly have access to each and every call that AI is handling, each and every call transcript of from those conversations, each and every action item that's logged into an EHR or practice management system that they can look at. So there's almost like, if not for practice, like we have a team at our end who's constantly looking at each and every small action of agent, ensuring that everything is going as per different privacy and security policies that we have internally, and also what practices have, or everything from HIPAA to other important aspects of sort of how AI needs to be deployed. I think that human supervision combined with tech sophistication on observability and evaluations, I think contribute significantly to privacy, HIPAA, and a bunch of other important security aspects of implementing this technology and ensuring it's successful, something that we've been able to do.
Terrific. Well, that's it for another episode of CareTalk Executive Features. My guest today has been Chetan Reddy. He is CEO of Confido Health. We've been discussing how AI voice agents are solving healthcare's patient access crisis. I'm David Williams, president of Health Business Group. If you like what you heard, please subscribe on your favorite podcast platform. And thank you, Chetan.
Thank you so much, David.